Genitourinary surgery involves surgery of the internal structures of the kidneys, adrenal glands, prostate, urethra, ureters, and bladder, and external structures of the penis, testicles, relevant accessory structures. There are three common approaches to GU surgery, and they are transurethral, which is performed with a rigid or flexible scope inserted through the urethra, open surgery through an incision in the abdomen, flank, or scrotum, and minimally invasive surgery, which is through the skin. Please review the outcomes for this chapter. The kidneys are the main organs that filter our blood. They are located in the retroperitoneal space or cavity at the level of the 12th thoracic vertebrae. The right kidney usually sits lower than the left. The two main layers of the tissues that make up the kidneys are the outer layer, the cortex, and the inner layer, the medulla. There is also a notch area on the medial side of each kidney called the hilum. The ureter, renal arteries, and vein come out of this area. The left kidney is higher because it is located under the spleen. The vein is longer because it is further from the vena cava and preferred for living donation. The right kidney is lower and underneath the liver and has a longer artery because it's further away from the aorta. The retroperitoneal cavity lies posterior to the peritoneal cavity and is covered on the anterior side by the retroperitoneum. The organs in this space are embedded in dense muscle, fascia, and fatty tissue. This arrangement supports and protects the structures from injury. Surgical access is through the abdominal peritoneum, the flank, or the back. The adrenal glands are paired organs that lie on the medial side of the upper kidneys. The gland has two layers, the outer cortex and the inner medulla. This gland secretes corticosteroids and hormones necessary for metabolism. They are also important in the production of norepinephrine and epinephrine, which are necessary for the function of the autonomic nervous system, the fight or flight. In adults, each ureter is about 25 to 30 centimeters long and about 4 to 5 millimeters in diameter. Urine moves along the ureter by peristalsis. Each ureter enters the bladder at the ureteral vesicle junction, which is located in the lower bladder. The urinary bladder lies behind the symphysis pubis in the pelvic cavity. The distal portion of the bladder is called the trigone. The purpose of the bladder is to act as a reservoir for urine until it is excreted by sphincter muscles in the bladder neck. The detrosum is a muscular layer of the bladder that is responsible for emptying and closing the bladder orifice. The urethra communicates with the lower bladder to enable excretion of urine from the body. There are several differences between the female and male urethras, with the length being the most obvious. The prostate gland is a muscular glandular structure the size of a chestnut. This donut-shaped gland lies at the base of the bladder neck and completely surrounds the urethra. This gland produces some kind of seminal fluid. The male reproductive organs include the scrotum, testes, epididymis, vas deferens, glands, penis, and the urethra. The scrotum is a pouch that lies inferior to the penis and protects the testes. The skin of the scrotum contains folds called rugae and has a muscle layer called the dartus layer that would contract in colder weather to draw the testicles closer to the body. The testes are suspended in the scrotum by the epididymis. They produce sperm and manufacture testosterone. The epididymis is a long duct that secretes seminal fluid. The vas deferens joins the epididymis with the ejaculatory duct. The accessory reproductive glands include the seminal vesicles, prostate gland, and the bulbourethral gland. The body of the penis is composed of several columns of tissue. The distal portion of the glans penis, which is covered by a free fold called the foreskin or the prepuce.